place to come by. We gonna have a good show. So you just left your shoe? Hey, you know, I peek in.
Bag of snacks.
Do what I enjoy. Watch.
Oh yeah. The Chancellor's here. Silence. Hopefully you're having a positive, productive day, people. Yes! Hopefully you're having a positive and productive day worldwide. It's your man J Petty checking in. People, I'm having a good day. The snow is falling. Yes, the snow is falling. It's really, really winter outside here in Chicago. Be careful, people. I really want to appreciate everyone that has been supporting the Bag of Snacks podcast. All of your emails and your donations and all of our sponsors have been really supporting. We really appreciate that. People, like I said, if you want to really support what we got going over here, please shop with our sponsors. The links are in the description box. Forex Drip is up to bat. I will be returning some phone calls and emails for some people that are interested. But I got a special email from a friend. Actually, an old co-worker. I won't say their name, but we worked in a mental health field together. We're both mental health counselors. You know, you sit in the hallway every 15 minutes. You got to go check on the patient, make sure that they're safe, well, and that they're being supported. That was my job. Counseling them, giving them advice, listening to them, making sure that they're doing well while they're in the hospital setting. So one of my coworkers, they reached out to me and they said, "Hey man, remember when we used to talk about this and talk about that?" And I said, "Yeah, I remember." And they do know that mental health advocacy is very near and dear, and that's what I'm all about, right? Really, that's kind of my background. But I've dealt with a lot of people that have had mental health issues, mental health illnesses, and substance abuse, drug abuse. The opioid crisis here in Illinois is horrible. Chicago and the surrounding suburbs. Heroin, fentanyl, any type of pill, every drug, cocaine, crack cocaine, Xanax, Percocet, Molly, any drug. It's here in Chicago. Not saying that that's a good thing, but I want to talk about it. So my coworker said, "Hey, why don't you do a podcast, a show on mental health?" I listened to her, and I said, "Well, I've did plenty of shows on it." She said, "No, do it on your new podcast." And she wants me to basically let people know how serious it is and how mental health illnesses and substance abuse have taken over a lot of communities, and a lot of communities need some help. They need some support. I do want to say thank you to all the first line responders, all the people I've ever worked with in the hospitals, outside of the hospitals, in mental field, or any job, but mainly in my mental health work, my counseling advocacy work. You hear me? My mental health tech work. Thank you to all the people I've worked with, and please, to all the patients that are in the struggle, they're feeling like they're going to use again, they're going to relapse, or they're going to have an episode. whether it's manic, suicidal, please take a moment to breathe and relax. Find your coping skill, your mechanism that works for you. And remember, there's always some help. There's always some support you can get when it comes to your mental health and your substance abuse. Now, a lot of hospitals have been closed down. Here in Chicago, here in Illinois in general, I don't want to just keep saying Chicago and forget about around the whole country, but I know about Illinois. A lot of hospitals have been shut down that provide these services for the people who are mentally ill or need some assistance and support. Now I am seeing a lot of the people in the homeless population. There's a lot of homeless people here in Chicago. They are sleeping outside, and I saw some as I was coming in. They were sleeping on the bus stop. And I thought, man, they just need a warm bed, a warm meal, and maybe some of their medication. Someone to talk to them, listen to them. Someone to help them get well. And I think about all the places, all the funding that have been taken away from the mental health field. How some of these places have closed down, shut their doors to the people who need their services. All these different clinics and centers that focus on substance abuse and mental health. No more. No more. We keep hearing, oh, it's not in a budget. We don't have enough money in a budget for the homeless, for mental health, to fight substance abuse. That's why you have places in the suburbs, outside of Chicago, the surrounding suburbs. The rich kids, they drive into Chicago to get their dope, their smack, their heroin, their dog food, their fentanyl, their pills. We have a serious problem here. Woo! Woo! We need help. We need some support. And so, when my friend, we were having that deep discussion, and I said, man, how can I address this? And she said, you know what? You just do what you do. You just do what you do. I'm not going to come with the fancy words, but I'm inviting mental health professionals, doctors, nurses, mental health counselors, therapists. I don't care if you were the janitor. I don't care if you was the lunch lady. I don't care if you worked in business administration. If you want to come on the show and talk about mental health and how important it is, please, link in the description. A lot of my coworkers that I still talk to. It's funny. Because we in the mental health field, we have this thing called HIPAA law. HIPAA law. Oh, I'm worried about HIPAA. You know, and patient confidentiality. Very important. We're not going to be up here talking about certain patients by name. We're going to be talking about our experiences, because I do believe that mental health workers, even CNAs, need to be celebrated, and they definitely need a pay increase after what they are about to go through, what they've been going through in the hospitals. I know how it was when I was working in the hospitals, dealing with the patients, how that anxiety sets in. You thought you were going to have a smooth shift. You thought until you got to door number 4 and they threw some shit at you, let some piss at you, and they wanted to fight you. and they was wrestling demons in their sleep, to somebody was vomiting, to two roommates were fighting, two rival gang members was fighting, but they both trying to kick their habit of heroin or drugs. But they keep hearing voices in their head that say, kill yourself. I dealt with that. And to the other mental health workers, you've dealt with it too, and we should have a conversation about that. Are you well? Are you well? So let's come on the Bag of Snacks podcast with Jay Petty. You hear me? But I do want to let you guys know there is some help. There is some resources. I am all about help and resources. So, guys, if you're out there, you need to support. In Chicago, there's resources, and outside of Chicago. Chicago Behavioral Hospital is a good place to go if you need help. And they have a hotline. Chicago Behavioral Hospital. Google those guys. They can provide you with services, support, and assistance with all your mental health and your chemical substance abuse issues. But if you need help with mental health, Chicago Behavioral Hospital. Also, Rivers Edge. Rivers Edge is another good one here in Chicago. Streamwood. There's other couple ones, but yeah. If you need help with your mental illness, please go seek help. There's plenty of hotlines out there, and there's people standing by waiting to support you. You know, but we definitely need to be putting more money into mental health, mental wellness. You know, so guys, come on this journey with me. Silence.